This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson, and we've got our guest in studio this morning. One guest you're very familiar with. The other, well, you'll get to meet today. First, please welcome President and CEO of the Mon Health System, Executive Vice President of Vandalia Health, David Goldberg. David, good morning. Good to see you again.
Good morning, Dave. How are you?
I'm doing well. How's summer been?
Oh, it's been fabulous. It's a blur.
You've been all over the place. I've been following your travels.
I'm like manure in the garden. I've been everywhere, but we're growing things. It's been great.
Well, good to see you again. And also in studio with us this morning is Dr. Brian Huggins, Health Officer and Director of Clinical Services of the Monongalia County Health Department. Brian, good morning. Glad you could come in.
Good morning, Dave. Thanks for having me in today.
And this is your first stop in since taking over the job, right?
It is. It's exciting. It's been a whirlwind. I separated from the military and moved to West Virginia, and it's been a journey.
Well, I don't know how often you... Oh, I'm sure you listen to this program every Monday. Let me put it that way. But part of the program is our guests have to talk about themselves at least for a minute or two. Now, Dave, we know David. We get it. We know where he's from, what he does, all that stuff. You, on the other hand, you're new and interesting. So, Brian, tell us a little bit about your background, your history and how you ended up here in Monongalia County with us.
New and interesting. That's a buildup.
You got a lot to live up to, Brian.
All right. So I'm originally from Wheeling, West Virginia. So I am a West Virginia native. And I had a little bit of a wayward way to medicine. I was not somebody that wanted to be a physician. I actually wanted to be a veterinarian.
Really?
Oh, yeah. That was when I was a kid. I volunteered at the Good Zoo, and I wanted to be a veterinarian, and then I realized I couldn't put animals to sleep. And that pretty much negated that. So then I kind of did a bunch of different things. I designed haunted houses for 15 years. I ran a supervisor of Blockbuster Video. That brings back memories, doesn't it? I even ran a Spencer Gifts for a little while. And then eventually theater is what got me back into getting my undergrad. And I got my undergrad at West Liberty University. And so doing haunted houses, the haunted house up in Wheeling, West Virginia, one of the owners, Mina Lash, she was the technical director up at West Lib. And she's like, come up and help me build a set. So then I got back into science as a major. Theater was my minor. And then I found the School of Osteopathic Medicine down in Lewisburg, West Virginia. And I just fell in love with the mentality, the patient-first mentality that actually, is part of that DO philosophy. And so I did that. Then I joined the military. Military helped pay for medical school. Spent a year doing general surgery out in Dayton, Ohio. And that's what I wanted to do. I wanted to physically be able to change something in a person. But then the lifestyle, it just became very clear to me that the lifestyle of a surgeon, I wanted to still be able to do other things, and it just didn't feel like the right fit. So then I kind of found preventive medicine, and preventive medicine is phenomenal. Preventive medicine is population health. And while I love the ability to do individual patient care, when you can actually make changes at a population level, when you can actually prevent disease before it starts, that's to me is the real power of medicine. And so that's kind of how I found my way, and then I had a little bit of stop in Alaska where I met my wife, got to fly in an F-16. Then I went to Germany and worked as a NATO liaison for a little while for U.S. forces, and then spent some time doing research, public health research at the School of Aerospace Medicine in Dayton, and now I'm here.
I'm going to have you back one day, and we'll just talk about some of the things you've done in your career, because the guy who went from wanting to be a veterinarian, who ran a Spencer's Gift, which kind of cracks me up, ends up going back to medicine. I was right. It's an interesting pathway to bring you back here to Morgantown. So what about this opportunity? And we'll get to today's subject. What about the opportunity to work with the Mon County Health Department? How did that interest you, and what really drew you to this position?
So public health, being in the Air Force, I went into a field called flight medicine. And as the chief of aerospace medicine, you end up being in charge of public health, occupational health, and then flight medicine. And I really got to know public health there. And coming here to Mon County is just such a great opportunity. Mon County, I didn't realize in the state of West Virginia that there are only I think there's actually 4 full-time health officers right now for all of the counties throughout the state. And there's 49 health departments. And I was just shocked at all of the services that are provided here. And to be a part of what is really essentially one of the largest health departments for the state of West Virginia, to be able to have that ability to be close to home, which is Wheeling, but to be able to be here, influence health for WVU, for the students here, to be close to the School of Public Health, to be able to work with our hospital partners. I mean, we've got Mon Health, we've got WVU Medicine, just to be able to do that and help move the needle. The biggest thing for me is we just recently came out as being 50th in the country for health. I don't like being 50th. I'm a proud West Virginian. I don't think any West Virginian wants to be 50th of anything in the country. So I really want to be able to not only influence health in Mon County and influence health in our counties around us, but I want to help move that needle in West Virginia, and I want to get us out of the basement.
Brian Huggins, Health Officer and Director of Clinical Services of Monongalia County Health Department. David Goldberg's here, too, President and CEO of Mon Health System. So, David, here, before we go to the break, explain why you two gentlemen came in here today.
I think you heard exactly what Brian was talking about. We partner well. Mon Health Medical Center is the county's hospital. So when we got to know each other, we started talking about how do we stop being 50th. Now, I'm over 50, and I think 50 is great from an age perspective, but not when your outcomes are the bottom of the barrel. So how can we educate the community? How can we partner, get the word out? I don't know if the community knows, but we do a community health needs assessment between WVU Medicine, Mon Health, and the health department on its cycle. So how do we take that data, partner even more strongly, and improve the community's well-being?
And we're going to be doing this, we're going to have you guys in monthly to talk about public health, the community, and everything in between, right?
That's the goal. I really want to make it very relevant to our listeners. So that's my priority, is that we're going to talk about topics, maybe stuff that you're hearing in the news. It's going to be stuff that's seasonal. And, I want to have a little bit of fun with it, too. So I'm hoping to have maybe a game like Guess the Disease. We might have a public health student in here, and I'm going to bring up something that you might only see in Africa. But, there's this one disease that is kind of crazy, and it's this worm that gets in your body, and the only way to remove it is by slowly twisting a stick around it. Like, there's just some fascinating stuff out there that's, also, I guess, a little bit gross.
But I have to jump in. We're not going to scare the listeners.
We're not going to
We're just going to educate the listeners.
Maybe I did do haunted houses.
I know. October is going to be fabulous.
David Goldberg, President and CEO of Mon Health System, and Monongalia County Health Officer Brian Huggins joining me in studio this morning. Hey, we got to take a quick break. We'll continue the conversation right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
David Goldberg, President and CEO of Mon Health System and Executive Vice President of Vandalia Health. Dr. Brian Huggins, Health Officer and Director of Clinical Services of the Monongalia County Health Department, joining me in studio this morning. Brian, I'll kick this question to you. You kind of touched on it already. As we get together once a month and talk about public health and Mon Health and how it all interconnects, what are some of the things you want to tackle? You kind of talked about putting a fun spin on some of it, but I'm sure some of it's things people know, they need to know, or maybe think they know.
Yeah, absolutely. It's key, exactly what you're saying. I get asked a lot of questions about topics that come up in the news. And, I spent the past 3 years, I helped evaluate research for the Air Force to determine, are we going to change policy? Is this something that we're going to act on? And there's a lot of research that makes headlines, and it can be very deceiving. So one thing that I love to do is I love to be able to help interpret that from just a normal person point of view. You try to pick up a journal article and read it as a regular person. Even as a physician, sometimes you're like, this is really difficult to understand. One thing that came out recently, as an example, for years and years and years, I think we all heard, if you have a glass of wine with dinner, you're actually healthier than if you don't have a glass of wine with dinner or have any alcohol. And then they just came out with a report that said absolutely no alcohol is actually healthy. Well, what changed? What's really interesting is they went back and they looked at that study, and this is what's so important about how you design these studies, is that when they looked at people that didn't drink alcohol, what they didn't take out were previous alcoholics. So if you had alcohol abuse and you weren't currently drinking, they included you in the I don't drink category. So clearly down the road, a lot of these people developed liver disease, right? But they were lumped into the I didn't drink. So now when you have their diseases piled into people that actually don't drink, it looks like the people that drink a little bit are actually healthier. And so when they went back and they controlled for that, where they took those people out and said, okay, now let's look at just truly people that don't drink. Well, those people are actually healthier than people that drink a drink. So it's just one of those little things that being able to help explain that for people, because it's confusing. You hear, well, wait a minute, you told me I should drink a drink. Now you tell me I shouldn't drink a drink. What am I supposed to do here? So things like that I think would be important to talk about.
My favorite example of that is eggs. Eggs were good, then they were bad, and maybe they're not so bad anymore.
Cholesterols are great. It's a great topic. They did a 20-year study. We've been giving people statins for 20 years to lower their cholesterol. And they went back and they wanted to pat themselves on the back and go, we did such a good job. And what they found out is outside of diabetics and people with certain risk factors, it didn't actually move the needle at all. It didn't actually prevent death, and it didn't significantly improve disease. So now there's a whole reworking of how we don't just look at your number anymore. And you have to put in a bunch of different factors. But same thing, that's with eggs. Eggs are bad. Fat. Oh, we got to get rid of fat.
Fat's bad.
Yeah. And then it's carbs are bad. And yeah.
Well, just to put an exclamation mark on that point and why I'm looking forward to these conversations, we've all got our smartphones in here, right?
Yep.
So we've got, it's not outlandish to say we've got every bit of information ever known to man in the palm of our hand. Yet, with that information, I don't know if it's made us smarter or, in some ways, you look up your symptoms and you play your own doctor. And go, oh well, clearly I have this 1 in 10,000 case of something measles from something. Clearly, that's what this is. Has it helped or hurt having all this information available, or is it just hard to decipher it all for lay folks like most of us listening right now?
It's a double-edged sword.
Yeah.
I am definitely a provider that believes that when my patients come in and they come in with an article they want to talk about, I love that. I love having an informed patient. I know there are people out there like, oh, I wish people wouldn't get on WebMD. I like it because it's an opportunity. I love teaching. I love talking to people. So to me, that's an opportunity to discuss something important. And sometimes they bring something in I haven't seen yet. It is almost impossible as a physician to stay current with literally everything that's coming out. You go through medical school, they teach you the newest stuff. You get out and you start working with physicians that have been practicing for a while. And you're like, how do you not know this? I learned this in medical school, and then you realize after you're out for 5 or 10 years that, wow, it is really difficult to stay current with all of that information. So the downside of it is, yes, you do get, we just had a measles case recently. Mm-hmm. And that was one of the first, that was how I cut my teeth here in Mon County, as we had that first measles case, and we had 150 contacts that we were calling. And of course, then providers become a little more cautious. And when they see a rash they're not sure of, they're a little more willing to refer that over. So you do get that. But that's where you have to have patience. Like someone in my position, I'm always willing to take those phone calls. I really want to be able to make sure that we're doing the right thing because we do want to prevent that disease.
And David, let me bring this back around to what your role here is in managing this hospital system. You're very much involved in community hospitals. Obviously, we've got the big Mon General here, but you've got the community hospitals down in Marion County and across the state. So having this type of community relationship is really what Mon Health, and I'm speaking for you here, but it's one of Mon Health's goals and one of your objectives.
Absolutely. We're a community-based system, so everything we want to do, we want to make life better. We want livability. We want people to thrive in the communities they live, work, and play in. Partnering with all of our health departments, in particular with Dr. Huggins, is so vital to make sure we're aligned. You're going to laugh when I say this. I don't want a person coming to the hospital unless they really need to be there. Are they in their primary care home? Are they getting the care they need in what I call the clinic or ambulatory environment? We have many patients who utilize the health department services. How do we together between all the health systems with the health departments, make sure we're getting care close to home, take care of them where they need to be, and when they're sicker, then they use the emergency room or they come into the hospital or have a procedure. So we're excited about the future, and candidly, the show that Dr. Huggins is going to do is all his. Who he brings in, what he talks about is his, because while we're educating about Mon Health services, now I think the next level is what's around the broader community to be able to educate, get patients to own their health care, hopefully utilize less except for what they really need, and partner with the health department to make us a even better, more healthy community.
And Brian, I bet this makes, well, maybe it doesn't make you cringe, but it does me when I hear here in Morgantown, well, we lack XXX, whatever the case may be. The fact of the matter is the health department, and you got Mon Health, and there are a lot of services available that cover a lot of, not only a wide variety of I don't know, ailments, I don't know if that's the right word, but also it makes it available to just about everybody in the county, I guess is what I'm driving at.
It does. We offer a lot of services at the health department that a lot of people, and that's something that we're going to cover through time, is what do we do at the health department? How can we help you? But, there's also services. There's a lot of other community members out there and nonprofit organizations that are really dedicated to trying to get people healthy. Everything from Health Right that can provide some free health care to just even the Ascend program that's working on getting people into West Virginia, but also trails that people, to be able to get out there and have safe bike riding, safe trails. There's just so many things out there that are really trying to help. And I know both David and I, one of our big things that we've talked about is, the cost of healthcare. And we both want people to be able to afford the care that they're getting. That is one of the things that prevents people. Like you said, there's all these services out there. Why aren't people using them? Cost is a huge factor. One of my first shows, it might even be my first show, we'll be talking about why is health insurance getting so expensive and why is it getting harder to find providers that take that insurance, and just kind of talking through some of those things to help people better understand how the system works and what resources are out there to help you.
Guys, we have run out of time, but very much looking forward to the shows. Brian, looking forward to get you back in the studio. David, always a pleasure. Glad you could stop by today.
Oh, thanks for the opportunity. Thanks for all you do.
David Goldberg, President and CEO of Mon Health System, and Dr. Brian Huggins, Health Officer and Director of Clinical Services for the Monongalia County Health Department. He will be back on a monthly basis. Guys, thank you so much for stopping by.
Happy Monday.
Thanks for having us.